That strategy was built around two studies, a closed system study and the Canadian Urban Transit Association's National Transit Safety Recommendation. David Cooper authored both of those reports. He joins us now from Vancouver. So David, transit safety is an issue in about just every major Canadian city. You've had the chance to experience several of those transit systems firsthand. What did you see? Is there a common issue across the country when it comes to safety on public transit?
So what we've seen on public transit since the pandemic is transit was one of the very few public spaces that remained open. And we saw a change of what was happening in the transit environment. And as we're seeing in other public spaces, a lot of societal complexities when it comes to substance use, when it comes to mental health, when it comes to homelessness. And transit is a safe space. And when we have a number of complexities playing out on our streets and our parks and other public spaces, we're now seeing these complexities play out on transit. And this is a conversation that's occurring in Calgary and a conversation happening amongst public transit agencies all across Canada.
So what are some solutions then? Could closing the system or more enforcement help, or are there some other options that we need to look at?
So what we saw today that went to City Council in Calgary was the country's first multidisciplinary transit safety strategy. And one of the pillars of this strategy is really integrating our data of what is occurring in public transit. We have different data sources, be it from Alberta Health Services or Calgary Police Service or the Transit Public Safety, to really understanding what is playing out on our public transit systems and what some of those societal considerations are, and also safety considerations, but also staffing. When we talk to transit agencies, we talk to staff, we talk to customers. Staff visibility is very important, and it's not just staff visibility from the purposes of peace officers or police officers, but it's also community outreach workers. We don't have a sole way. You can't force your way out of this. We have a huge conversation when it comes to outreach, and one of the things that we're going to see in the strategy, if implemented, and we saw the initial approval today, is having the ability to have the staff across the whole system to provide more of a frontline support and help to individuals on the transit system and those that may need support that are really utilizing our transit system for several different reasons.
So in terms of what the City of Calgary can do to fix this, as you said, you need more supports. What do you make of the strategy that was put in front of councillors this afternoon?
So this strategy is the first one that talks about the integration of transit public safety and the police service and also community service providers with the hubs. That's a conversation we had in the closed system study, where we want to get our staff out in the system. We want to provide more of a frontline response. We want to have more of a visible response. And you're going to see that all across the system in different points where we can reduce our response times. But then also we need to recognize right now a community outreach team is very centralized to downtown and to Chinook Station. And we have needs across the city. We have a mobile population that requires social service supports, and we have calls for service when it comes to trans safety across the city. And we need to have more ability to have that visibility and that staff to be able to deploy across the system. And that's one of the key parts of this. The other part is integrating with 911. Right now we have different radio channels, we have different ways for people to call into providing help or services, or even into 211, and centralizing that into one component. It allows the city to have the right person with the right tools, the right skill set, the right place at the right time. And that's a significant change that we're seeing in our deployment model that you'll see on Calgary, and I think would be really a national first when we're looking at transit safety across Canada.
So being potentially a national first, if a strategy like this is successful, is it something cities like Edmonton could try to emulate as well?
It is something. We have elements of that are occurring in place. There is a transit safety framework in Edmonton. There was a recent announcement of $5 million in terms of the creation of one of their first hubs that you'll see at one of the underground LRT stations in downtown. But there's work to be done when it comes to the integration of data between the police service and the city. But also, they were one of the first cities that had a community outreach transit team, and that team saves lives. That team provides referrals to housing. That team provides referrals to social services. That team is all about the continuity of care and having the ability to build relationships with people, and that team saves lives and really spurred a lot of these conversations of other teams across the country. And a lot of transit agencies are looking at these community service models to support our transit safety efforts and our transit systems today.
All right, well, thank you so much for your insight into this today, David.
All right, thank you.